You know, when we buy everything from tomatoes to what it is, you know, we think green, but you know, it hasn't really permeated our life. Because of course, if you save lives, you know, that's the most important thing. But you know, it's not as simple as that, because if you develop medicines that are going to be taken for life, and it's you know, preventing primary infarction or something, you know, you have to think about, you know, is this sustainable the way this is done? So, you know, this is about the synthesis, you know, could you rethink chemical synthesis with different protector groups and everything? This could have a tremendous impact. Also down the line is, which is not part of this call, but which I would hope would be something we could work on in the future, is actually about understanding better what kind of chemical structures, because on the one, we want medicines that are stable, right? They should, you know, produce them, and they need to be still there when they reach the patient. And secondly, when you take them, they should somehow be absorbed and have some effect and not be degraded in 2 seconds. And of course, medicines against cancer or in transplantation to protect rejection of organs need to be somewhat toxic. They are toxic. They have a toxic effect on us or the tumors or something, but also in the environment they have toxic effects. So with that, I just wanted to illustrate a little bit that this is so broad. You know, this is so broad. Drug development, drug discovery is so broad. It ranges from the very advanced understanding of molecular kinetics, which Roxandra showed at the end, to some facts about this, you know, synthesis of molecules, because at the end of the day, many of these are chemicals. Also for the biologics, there's a lot you can do about the manufacturing. And I fully agree with the Commission representative here, with Roxandra, that some of these are particularly interesting because you can get going immediately. The results of this can be used immediately by those that are involved in drug discovery. And that's also an improvement, I think, in Call 4 compared to some of the previous ones. Finally, I'd like to highlight what we have in Cluster 1, which is about the information systems. We have people that want to say, oh, that's really research, you know, sort of do you get a medicine from having a database? Well, but there is so much knowledge that we don't share in a proper way. And I just keep thinking, as I have a regulatory background, I worked at the Swedish regulatory agency, the first thing I did, and I've spent a lot of time visiting the EMA over the years. There's so much information in the hands of the regulators, which ought to be made public, which we could learn from. There's so much information available in companies on things we discontinued. Imagine all the dead drugs, all the knowledge from them. Where does that go? Where does that go? Well, of course, we are in the company, we're disappointed. Something fails. It could be early, it could be later, it fails. What do? Well, you don't want to, you know, spend time digging into that and finding out why it failed. You know, that's not very productive or good for your spirit. You move on to the next. So this is something we're discussing for the future calls, is, you know, what do we do to really combine and pool all the information there is, because we need to do that as well in this collaborative mood between the industry, the European Commission, and academia in Europe. So I'll finish with that, and I'm happy to take any questions. Thank you.
Thank you very much, Richard. We have time for just a few short questions to the industry. Yes? Please try to be short.
Why is failure? Why the drugs failure? Because we make everything by chance. We should know the background, why this is developed, and then we will use less money and we will have the evidence. And I will like to discuss with you because.
No, I fully agree. I think we will all look back at the era from 1960 and onwards, and we will shake our heads and just, oh, I can't believe this. You know, we screened and we find something and we tested and it was reasonably safe, and then we started using it. Hopefully, 20, 30 years from now, we will all be much more rational in the way things are developed, that it's targeted, we know what patients will benefit the most, and we know how to implement it in healthcare as well, so that the right patients get them and they are followed. So I think that this will be a lesson in the history books about, you know, a lot of spent money, and now on the one hand you can say that it's easy to sit and say that because we didn't have the knowledge about the genome and the proteome and epigenetics and all this. We didn't have that knowledge in the 60s and the 70s and the 80s. We have it now, so hopefully we have an era ahead of us where we will see that type of much more targeted and much more effective drug development.
Another question, please identify yourself and speak in the microphone.
Is it working? Yes. Nora Benavides, CEA. With this issue of big data uses, the hidden data that are everywhere, there is a big issue with standardization of the data, the logistic, how they were collected, the quality, and so a lot of theoretical issues afterwards, and how to use that, how to do mathematical models that are relevant and robust, how to link that with biology and clinics. So it is a lot of cultural problem, a lot of semantic problem to make people discussing, coming from very different areas.
Yeah.
And we are not really trained for that.
No.
And industry have its own pressure, which is financial pressure under crisis. And academic also have their own pressure. And so sometimes it's very difficult to make people understanding each other, even if the goals are quite common. And here, if we do not train people for that, even if we have the will to go in this direction, it will be difficult to be efficient in the goal. So what are the actions that can be done to...
Well, IMI is the perfect place to do this. So, you know, any advice from you, colleagues, as it's the industry, it's EFPIA members that sort of design these calls, and then it's Michel's people that will, in competition between groups, select the ones that will carry this out. Any input to EFPIA, any input to us, to me, to my colleagues, on how to do that. And the academic groups in Europe that have brought together, as you say, mathematics and IT and knowledge management people that have that, inspire us, so that in the final part of IMI we can have more of this. I fully agree with you. This is something we just need to do.